Hello and welcome to my channel. I'm Nurse Alyssa and today we are going to be talking about Mepilex Lite. It's a silicone foam dressing. But first, if you could hit that like and subscribe button, it would be greatly appreciated as it does help my channel grow. So let's get started. So Mepilex Thin Silicone Foam is a thin, highly conformable foam dressing with a silicone adhesive layer for a non-traumatic dressing removal. So this product is good for wounds with scant to small amounts of exudate, so not a whole lot amount of exudate, and wounds that are friable or very fragile peri-wound tissue, okay? So especially for our elderly clients whose peri-wound just seems to want to tear, this is a good product choice for them. We can also use this under compression therapy. Some precautions. So you're going to want to consult with a physician or a wound care specialist prior to using this on any patients who have ischemic lower legs or feet. Okay, so the blood flow isn't proper to them. When using Mepilex dressings with oxidizing agents such as hydrogen peroxide, make sure that you're drying the peri-wound very, very well before applying the dressing, okay? And that's all Mepilex dressings. Some contraindications: we're not going to use skin barriers or sealants. We're not going to use this on completely dry wounds. So if you have a bone dry wound, we're not using this, okay? So as long as you have some drainage, scant to small amounts, it's perfect, but we don't want to be using it on a dry wound, okay? If redness or sensitivity does occur, we want to stop using. So to apply this dressing, just like any other wound dressing, we need to clean the wound. So we're going to cleanse it and irrigate it with either sterile saline or sterile water, depending on what your preference is. And just make sure to dry the peri-wound very well. Choose a dressing size that ensures that the pad portion is at least 2 centimeters past the wound, okay? So you want it to cover the peri-wound by at least 2 centimeters. The dressing can be cut, and if we're using any oxidizing agents, just make sure that you are drying the peri-wound very, very well. So an example of that is hydrogen peroxide. So you're going to place the dressing directly over the center of the wound, making sure it overlaps the peri-wound, and then you're going to gently apply pressure to the peri-wound tissue just to make sure that you have a good adhesion to that tissue so it's sticking well. So you can use this as a primary dressing right on the wound or as a secondary dressing, so a cover dressing. And then you're just going to secure this either with tape or cling. So to remove this dressing, you're just going to gently lift up on the tape and slowly remove this dressing. The expected outcome is that we have no peri-wound skin maceration, so the skin is perfectly intact and well. The frequency of dressing change, it is going to completely depend on the amount of exudate or drainage coming out of the wound, okay? So when the drainage is within about 2 centimeters of the edge of the dressing, that's when we're going to be changing this. So it can stay in place for up to 7 days, but you do just want to base it off the amount of exudate coming out of the wound. So I do have here the different formats and sizes it does come in. It is a non-bordered dressing, so there is no border. So this is completely the pad that you receive. And it can be cut. So that is all that I have for this video. If you haven't done so already, if you could please hit that subscribe button as it's truly helping my channel grow. It would be greatly appreciated, and I hope to see you in my next video. Bye guys.